Welcome to the Practicing with Dr. Nathan Goodyear podcast. I'm the medical director at Brio-Medical in Scottsdale, Arizona. I am both a conventionally trained and licensed medical doctor as well as a licensed medical homeopathic doctor. This podcast is your resource for a scientific-based discussion of all things cancer and beyond from a natural, holistic, and integrative perspective. It's time to teach the body how to heal. So here we go. Ivermectin, the wonder drug that became the wonder dog, that became the wonder dud, that possibly, maybe, could be the next wonder drug for cancer. I want to explore each one of these, actually dive into the evidence, because there's very clear a move to discredit any science as it relates to thinking outside the narrative. So we want to dive into ivermectin as the wonder drug, the wonder dog, the wonder dud as I proclaim it, and then the wonder cancer drug. These are the four categories. So let's start off with the wonder drug. And the way I want to approach this is, of course, we all have opinions, and these opinions are based on experience and sometimes facts and sometimes not facts. But what I want to do here is I want to use the words of the scientific publications and let them provide the claim, the evidence. And so we'll see what the evidence shows and what the evidence has shown and where the evidence maybe is going, so that you don't think it's just my opinion, but that it actually is in the published scientific literature, and it's those proclamations that we're going to follow. So first, there was a 2011 study, and I encourage you to check this out. This will be in the show notes. There was a quote said, "There are few drugs that can seriously lay claim to the title of wonder drug. Penicillin and aspirin being the two that have perhaps had the greatest beneficial impact on health and well-being of mankind." This publication was entitled Ivermectin Wonder Drug from Japan, the Human Use Perspective. They were comparing ivermectin to penicillin and aspirin. So talk about wonder drugs. That was 2011. Then a 2017 article actually quoted saying ivermectin was a revelation. And actually the title of this article was Ivermectin, Enigmatic, Multifaceted Wonder Drug Continues to Surprise and Exceed Expectations. It was 2017. Of course, that was pre-pandemic. And here's a 1988 quote, a 2017 quote. Ivermectin proved to be even more of a wonder drug in human health, improving the nutrition, general health, and well-being of billions of people worldwide in humans in 1988. Not my words. That's the words of published scientific literature. 2004, so a little bit earlier, said that ivermectin quickly became a remarkable success. And then Journal of Antibiotics in 2017 said, today, quote, 2017, ivermectin is continuing to surprise and excite scientists, offering more and more promise to help improve global public health by treating a diverse range of diseases. So here they're not talking about just parasites. So what do they list? They list the unexpected, surprising potential of ivermectin as an antibacterial. Hold your seats now. Hold your seats. Anthony Fauci, if you're listening, hold your seats. Antiviral and anti-cancer agent being particularly extraordinary. So that was 2017, Journal of Antibiotics. Again, pre-pandemic. Well, that seems to kind of destroy the narrative that was propagated by the late night comedian show host, where they try to label it as a horse dewormer. And it's really interesting if you go back and look at that, how coordinated that effort was. Now, what's interesting about those late night show hosts is that they don't have medical advisory boards. They don't have scientific panels. that evaluate the evidence. So in essence, what they were doing is they were just propagandizing a narrative, in honest, being useful idiots. When you look at ivermectin, what it really was initially as an antiparasitic was used in the treatment of a wide spectrum of parasites, river blindness, elephantiasis, and even scabies. But what's been discovered over the time course of study and evaluation is ivermectin's impact is much broader. So then we shift from the wonder drug to wonder dog. See, it was initially approved as a therapy in the veterinarian medicine world in 1981. And that's when it was initially introduced as a commercial product for animal use. So I guess at least related to the late night show host, they were right. That's where it began. And what's interesting, this came out of research and collaboration between the head of the antibiotic research group at the Tokyo Kitasato Institute, if I got that wrong, my apologies, and that with Merck, particularly Dr. William Campbell. And what they discovered that there were these single-cell organisms that were producing collectively, you might call them bioweapons. That's what Dr. Kathleen Ruddy described them. So I encourage you to check out that interview with her where she tells her story and she describes ivermectin as a bioweapon. But here it was collectively the what are called avermectins. And so these single-cell organisms in the soil have no functioning immune system, no defense. So they produce these weapons that attack other life, bio, and that's to protect themselves. And isn't it interesting how you can look at cancer in a very similar light? So they were looking at the soil, trying to evaluate for new innovation in the use of antibiotics. And they collaborated with Merck Pharmaceutical to then discover ivermectin, a derivative or one of the avermectins, and they brought this to market for animal use. Now, the mechanism of action was initially described as such. Ivermectin activates glutamate-gated chloride channels in the parasite, causing a large amount of chloride ion influx and neuronal hyperpolarization, thereby leading to the release of GABA-aminobutyric acid, that's GABA, to destroy nerves and the nerve transmission of muscle cells, inducing a paralysis and killing of the parasite. So basically what's happening, it's causing the shift of ions and it's leading to a paralysis and thus death of these parasites. Now, if we stop there, the late night show host would have been correct. It was a horse dewormer, well, dog dewormer, cat dewormer, you name it. But interestingly enough, it got FDA approval for use in humans in 1987. I know they left that part out, so let's forgive them. They didn't have that scientific advisory panel. They were just telling jokes. And it's estimated that every year, 250 million people, let me repeat that, 250 million people every year annually are taking ivermectin to combat these parasitic infections. Now, obviously, it's in particular parts of the world, but this is looking at numbers pre-pandemic, before the general public became aware and before a lot of medicine became aware of its very likely and potential outside benefit from parasites by ivermectin. That is antiviral, antibacterial, and yes, probably even anti-cancer. And when you look at it, it's very interesting because, again, it's a horse dewormer, right? So talking about the, Kentucky Derby, that's the only benefit for this. But in 2015, this collaboration brought forth a Nobel Prize award in physiology and medicine for ivermectin. And as I mentioned in the interview with Dr. Kathleen Ruddy, at the same time, same year, 2015, another antiparasitic, this time for the treatment of malaria, brought forth an award in 2015 for artesunate, that's artesunate, another antiparasitic, but for the treatment of malaria. And it brought forth the award for Nobel Prize in Physiology and Medicine. So in 2015, 2 awards by the Nobel Prize Physiology and Medicine are antiparasitics that are now proving to have strong anti-cancer properties. Very, very interesting. So a wonder dud. So wonder drug becomes wonder dog becomes wonder dud. The Associated Press said that ivermectin was a, quote, unproven treatment of COVID. Of course, they are the bastion of scientific methodology, so we must follow them, right? And we have to be fair and be honest. There were some studies that suggested that ivermectin may or may not have benefit in COVID. So there was an article from 2022 that said among patients with mild to moderate COVID-19, treatment with ivermectin compared with placebo did not significantly improve time to recovery. These findings did not support the use of ivermectin in patients with mild to moderate COVID-19. So timing is always everything in the treatment, everything. So when you look at vitamin C and sepsis, when you look at antibiotics and sepsis, if you wait too long, it doesn't matter. Nothing is going to help. It doesn't matter if it's natural, holistic, integrative, conventional, or not. You let something go too far, the circling of the drain process is too far gone. So this applies across the uniform therapeutic options. So here in this article, they were talking about mild to moderate, and they talked about improving time to recovery. What, did it prevent hospitalization? We don't know. They didn't look at that outcome. What if they looked at, severe COVID-19 patients that were admitted to the ICU? Did it improve recovery time there? Did it reduce the need for intubation? None of this was questioned in this particular study. So you have to very carefully look at studies with a keen eye, because a lot of studies today, you can read the outcome or just the conclusion, read the abstract, and get nothing about the actual structure and power and evidence provided in the study. You could say, oh, ivermectin doesn't work. Well, you could say, well, it depends. It depends on what question you're asking and what group you're looking at. And so in this particular study, they didn't really find a benefit. And again, we have to be very careful about where we take our resources and our conclusions from. I think if you look at a media company that has no scientific or medical advisory board behind it and no transparency about that, you have to look at that as really just crafting and supporting a narrative. Now, this is going to shock you, because when we look in the arena of medicine, they have scientific or medical advisory boards that are looking at the science. So here was a quote from actually Mayo Clinic on ivermectin. And I'll read the whole quote. Quote, the drug ivermectin used to treat or prevent parasites in animals and in humans, they said that. I'll continue the quote, isn't a drug used to treat viruses. The FDA hasn't approved use of this drug to treat or prevent COVID-19. Continuing the quote, taking large doses of this drug could cause serious harm. Don't use medications intended for animals on yourself to treat or prevent COVID-19. Now, I like words, and I think what we say with words are very, very important. In the first sentence, they say it's used to treat and prevent parasites in animals and in humans. And as I told you, it was approved for human use in 1987, 1981 in animals. The FDA hadn't approved the use of this drug to treat or prevent COVID-19. That's true. Taking large doses of this drug can cause serious harm. That's vague. What does that even mean? What dose? What harm? Don't use medications intended for animals on yourself. Wait a second. They're completely contradicting their first sentence. So which is it? Is it for human and animal use, or is it only intended for animals, so don't use it on yourself? Which is it? So here's a bastion of scientific principle, right? Methodology. And you come out of reading this 4-sentence statement not knowing where in the world they stand on the principle. We have to be very careful and follow the science and not follow a propagated political narrative. So that is, wonder drug becomes wonder dog, becomes wonder dud, highly questionable wonder dud, to possibly the next cancer wonder drug. So again, I do not want you to take my opinion. Let's follow the evidence. It's very important. In science, we must ask questions and follow where those answers take us, not construct questions intended to direct towards preconceived answers. And that's what a lot of medicine and science has become today. So let's go through some quotes about the potential, because one of the things that Dr. Paul Merrick, Pierre Corey, Kathleen Ruddy, and myself and others are looking to do is to actually determine the actual science, the data, the outcomes of ivermectin in patients with cancer. We're going to go through the scientific methodology of asking the questions and see what the answers tell us, and then follow it that way. Now, understand, when you do that, you have to have a hypothesis. You have to have a question, an idea of something that might happen. So you start with a hypothesis, you ask the questions, and then you follow where the answers take you. They may prove that hypothesis, and they may disprove that hypothesis. So here's some quotes. Now here's a 2021 article, and I'll hit some highlights from this quotes from this article. It's called Ivermectin, a potential anti-cancer drug derived from an anti-parasitic drug. It has, quote, anti-tumor effects, including the inhibition of proliferation, metastasis, and angiogenic activity in a variety of cancer cells. Ivermectin promotes programmed cell death, including apoptosis, autophagy, and pyroptosis. These are different types of programmed cell death. Ivermectin even, they said, can also inhibit tumor stem cells, cancer stem cells. It's the backup copy that we want no part of, that cancer uses to mutate and recur and spread. And it even reverses multi-drug resistance. So when people, as they progress through treatment from conventional perspectives, they can approach resistance. Ivermectin overcomes that. And get this, it exerts the, quote, optimal effect when used in combination with other chemotherapy drugs. See, the authors here are not saying, oh, we need to replace these drugs and this care with ivermectin. They're saying, look, this is what we're seeing. And interestingly enough, if we combine it with chemotherapy, again, they're not attacking it. They're saying, look at this. It works better. Is that not what this is supposed to be about? Helping patients get better results and less side effects? So in 1996, that was the first time that ivermectin was mentioned in the public literature as it relates to cancer. 1996. And it was in ivermectin's potential to reverse multi-drug resistance in tumors, particularly what are called P-glycoproteins. These are transporters that basically would pump harmful substances outside of the cell. It's a plasma membrane protein belonging to the ATP binding cassette transporters family. Again, I want to be technical here, and I want you to show you that, look, the science is there. It's an efflux pump that reduces the intracellular concentrations of broad ranges of hydrophobic, these are fat-loving compounds. And this is this process is intimately involved in how cancer cells will become resistant to drugs like chemotherapy. Now, the second mention was in 1997, again, looking at the multi-drug resistant transporters as well. In 2004, a scientific publication actually entitled the article, Anti-Tumor Effects of Ivermectins. Again, that's the broader range of which ivermectin is one. That was 2004. So right around the turn of the century. Now, what about ivermectin as a potential cancer wonder drug? And I don't want to be hyperbolic here, okay? I want to be very careful because there's a lot of information and evidence that needs to be discerned. And that's what we are seeking to find. So when we look at a 2021 publication, again, this will be in the show notes, quote, we show that treatment with the FDA-approved anti-parasitic drug ivermectin, it induces immunogenic cell death and robust T cell infiltration into breast tumors. See, when you look at cancer, the immune system is intimately involved in how the cancer can protect itself against the immune system or how you can target and destroy the cancer. And T cells are an integral component of that. And here they're actually showing that the FDA-approved, hey, Mayo, FDA-approved anti-parasitic drug, it's actually inducing an immunologically induced programmed cell death, and it's doing so by infiltrating T cells, very important lymphocytes, into the breast tumors. And of course, we're talking about tumor microenvironment as well. Now, that publication, interestingly enough, was in March of 2021. So fast forward to September 7th, 2021. That's when the wonder drug became the drug for animals, the horse dewormer. So back in March 2021, they were talking about how amazing ivermectin is actually impacting the immune system within the tumor and tumor microenvironment to actually kill it. But then just a few short months later, no, it's just all about treating animals. So these timelines are very, very important to understand. And even looking at the combination of ivermectin with checkpoint inhibitors. Checkpoints are a lot of these, they're these new conventional immunotherapeutics, and we will use them because they have a purpose, they have a place. But they're looking at these key immune regulating checkpoints where the cancers can misuse that which is good for its benefit. See, cancer creates nothing anew, nothing. It just adulterates everything that already exists. So these checkpoints, if you think about it this way, we don't want the immune system attacking our body. If the immune system is attacking the body, that's autoimmune disease. That is not good. And so the body and the immune system has built these inborn checkpoints. It's the creation of the master to say, hey, this is self. Don't attack self. And cancer is sitting there on the sidelines going, I can really make use of this because I'm self. I'm just not a normal form of it. So I'll just take that. I'll express that. The T cells will come along and they'll just go, oh, moving right along. And they won't even see it. It's like a reference to Star Trek and the Klingon cloaking device. The cancer's there. The immune system comes along and seeks to interact, but the expression of these checkpoints allow the cancer to evade immune surveillance. And so here they're not talking about, again, ivermectin replacing therapy. They're saying, hey, it works with it. So now chemotherapy, now immune checkpoint inhibitors. Interesting. I wonder if those talk show hosts knew about that 2021 study in March. Probably not. Did their medical advisory board know that? I guess not. So here's a question. Did Anthony Fauci know that? Good questions asked. I don't know. I digress. Anyway, so let's look at the evidence. Again, so how many actual publications are out there on ivermectin, particularly ivermectin, not avermectins, but ivermectin in cancer? Well, in the United States, there is a website you can go to called PubMed, and this is where the predominance of scientific people will go to evaluate a lot of the journals, a lot of the scientific publications on various topics. It's a wonderful resource to use to begin your journey down the rabbit holes. On the PubMed in the US, there are 332 listed publications on ivermectin and cancer as of this morning, February 16th, 2024 of this recording. I just checked after I was having a cup of coffee. Now, there is a comparable form in Europe. It's called Europe PMC, interestingly enough. There are listed, same search topic, ivermectin and cancer, 3,824 articles. So when you look at PubMed versus Europe PMC, that's 8% listing on PubMed. Apparently, the research around ivermectin and cancer is governed by boundaries of countries and continents. Interesting. 332 versus 3,824. So what is science? Because this is important. Science is a blend, medicine, that is, as science, is a blend of science and art. There's a famous quote, "It's easier to judge the mind of an individual by the questions they ask rather than their answers." What if one is not allowed to ask questions? What does that do to one's mind? Does it make them, I don't know, mindless? See, science is simply about asking questions and seeking answers. It's seeking truth. There was an article from 2023 that was actually, the overarching theme of the article was looking at the topic of scientific education. And the title was "The Value of Asking Questions." There's a really nice quote in there. "The art of asking good questions constitutes an important skill to foster for practicing scientists." So they're saying this is a skill that needs to be encouraged. The curiosity of the mind, as I like to call it, needs to be encouraged. That's not my statement. That's a 2013 article statement. Unfortunately, I think what we have is a discouragement of this skill set. So then when we look at what's happened over the last 4 years and what we're seeing in science is we're seeing a form of censorship. Because science is the open discourse and debate of scientific ideas. Not scientific facts, but ideas. And with that is, debate, discussion, of course, disagreements. This idea that science is settled and there's 100% agreement, that's not scientific. We all have different perspectives and approaches, and we bring that to the table in the open public, transparency, to debate and discuss these ideas. And there'll be many areas where we will come to agreement, and there will be areas where we don't come to agreement. And that doesn't mean one side is right and one side is wrong. It just means there's an area, because of different principles or determination, that they disagree upon. We should welcome that. We should embrace that, because that will bring forth new innovations, new questions. So let's go through a little bit of journey here on the history of science. Sir Francis Bacon is considered the father of the scientific method. He proposed this method back in 1620 from a publication called Novum Organum. Now, he was influenced by Aristotle. In this proposal, he advocated an empirical, observational, reasonable method or methodology to observation. He was trying to standardize that which countered the existence of that time, which is more of a medical, physical, just conjecture. That was the science of that time. And conjecture is just a opinion or conclusion formed on the basis of incomplete information. So what Sir Francis Bacon was trying to do was to provide a guideline, a standardization to the process of asking questions for the purpose of seeking truth. Now, I found this as a very interesting aside. Though he advocated for an empirical observational reasonable method that countered the metaphysical conjecture of the time, there's this caveat this one website posted, but he was a religious man, and he believed in God and believed his work had a religious role. So apparently you can't be one and both. It's one or the other. You can't be both. You can't be a scientist and be a believer in God, apparently, though one proves the other for sure. It's interesting, he influenced people like Galileo, Sir Isaac Newton of the famous apple. Again, standardization of observation. But what we've had today is an evolution of this observation and questions and curiosity of mind, and it's evolved into a series of protocols. I call it protocolology, the study of protocols. But what we are supposed to be really about, and this is, I think, the contrast to today versus then, was the comparison of protocols today versus the recognition of patterns. And that's really what Sir Isaac Newton, not Sir Isaac Newton, excuse me, but Sir Francis Bacon was trying to do, was to try to standardize this pattern recognition that brought forth questions. And if you've heard me write or speak on additional podcasts or at conferences, I talk a lot about dots, the collection of dots versus the connection of dots. Seth Godin said, students today are educated in collecting dots, but almost none of it is spent teaching the skills necessary to connect the dots. So kind of like what that article on science education was talking about, fostering the skill of asking questions. Steve Jobs, a little bit more modern there. So shout out to Apple. You can't connect the dots looking forward. You can only connect the dots looking backwards. Well, that's what we've been doing the last few minutes here, looking backwards, connecting those dots to the present to hopefully connect them to the future. So let's connect just one more dot here of the past, that of Galileo. He faced a Roman Inquisition, jail, and death threats because he dared, how dare he, challenge the outdated paradigm of thought at that time, and we'll get to it in just a second, by his support for the Copernican theory. Now, what was the Copernican theory? It was a model developed by Nicholas Copernicus in 1543. That's when it was officially published. And it was just mind-blowing what he proposed. Of course, at the time, not now, that the sun is the center of the universe. See, at that time, the standard thought, the standard practice of thought, isn't that interesting? Standard practice. I think I've heard that here in modern times. Standard practice of care. Yeah, that's it. Was that the earth was the center of the universe. Everything rotated around the earth. But Galileo was simply proposing that which somebody else had theorized. And the Roman Catholic Church ordered him to turn himself into the Holy Office to begin trial for holding this crazy belief that the earth revolved around the sun. They actually deemed it heretical. They called him a heretic because he did not follow the standard practice. Kind of comparison to protocols. And they accused him, they imprisoned him, and they secluded him from the trial to be able to actually defend himself. Well, we didn't have the Roman Catholic Church doing that during the pandemic. but we had a lot of those same principles and guidelines being followed. Just it wasn't Galileo, it was doctors that were simply asking questions and proposing the extrapolation of ideas that was already published in the literature. And they were trying to save lives. Interesting, that word heretic, it's one that holds a doctrine or variance with established or dominant standards. No pointing to truth, no pointing to facts. It's just what's the standard thought of the time. So let me present you with some references to what was thought standard of time principles or ideas that have now proven to be not so factual. The world is flat. Yes, I know there are people that believe that, but there was a time where the predominant theory was that the world was flat. Of course, the geocentricity, that is that the earth is the center of the universe, and it is clearly not. Now, this one was interesting. During the Middle Ages, there was a widespread belief that cotton that was imported from India came from a plant that produced a vegetable-like lamb. That's right, the lamb, but it was a vegetable form. It was the dominant theory at the time. William Herschel, he was a renowned astronomer, okay? So he was well recognized as a leader in his field of the time. He proposed a theory that the sun wasn't a star, but a gigantic planet. And he argued that it could sustain life. He hypothesized, again, asking a question, nothing wrong with that the sun was not hot, but rather cold. It was covered by a luminous material, and it was providing the reflection from the ocean, and that this could support life. Now, it was a hypothesis, a theory of the time, but it has since been proven to not be true. What about alchemy, in which men would try to turn metals into gold? We know that not to be true. And I would say that there's a dominant theory today that instead of the sun is the center of the universe, the human is the center of the universe. So you can see that being a heretic may actually be just one who is pointing towards truth, because it simply stands in variance to the doctrine of the time. Doesn't necessarily mean you're following truth if you're following the doctrine of the time. So Galileo, he was a heretic. Interesting. But he was speaking truth. So the second time that Galileo got in the hot seat, it was when he refused to accept the orthodoxy of the church, that Earth was the immovable center of the universe. And in fact, in 1616, the church told him, and they forbid him from holding or defending such truth. Sounds very similar. So here's point number one. When we look at orthodoxy, it's the correctness of opinion, especially when you look at theology. It's conformity to the church creeds, orthodoxy or orthodoxia. So here's an interesting question. When you look at the comparison, has science developed a series of orthodoxies, standard of cares? Has science, in a way, morphed into a religion? Just questions. It's okay to ask questions, I think, still. But they were called heretics. So when we're looking at ivermectin as it relates to cancer, wonder drug to wonder dud, from wonder dog to potential wonder cancer drug, if we're seeking truth and asking questions, and that is opposed to the standard of time, I guess that could make us a heretic. But I know the qualities and the principles of those involved in this study, and it is sound scientific principle. And we will not fall prey to name calling. We will seek out the truth and see where that goes. Time will tell whether we will be, quote unquote, forbidden from speaking our beliefs. So what we're dealing with is kind of a modern day form of book burning. And actually, when you look at cancer culture, it is modern day book burning. Censorship is the digital book burning form of that. That word censor, it means proclaim. Proclaim means to claim. It comes from a word clamor. Now the question is, of that claim, is it evidence-based or is it not evidence-based? It's not the claim. It's just, is it evidence-based or not? We all make claims every day. The question is it evidence-based or is it not? And then let's debate that. Cancel culture is also thought burning. It burns, it destroys the ability to think. It burns the ability to make questions. It's mind burning. It creates mindless people because you cannot think independently. And what it ends up doing is destroying innovation, and it ends up hurting patients. And that's our purpose as physicians. So enough of connecting the dots of the past to today. Let's get back to the principle here and the purpose, that's ivermectin. I just thought that was a very important deviation, because I think what we're dealing with as it relates to ivermectin and what we're going to see is a lot of those same retread processes. So repurposed drugs and medications, this concept is not new, and that's what we're looking at as it relates to ivermectin and many others. In fact, it was first proposed in 2014 in a project that was entitled the Repurposing Drugs in Oncology Project, called the REDO. I encourage you to look that up. The Repurposing Drugs in Oncology Project Cancer in 2014. It's well known that is the repurposing or repositioning of drugs. It's well known, well characterized that non-cancer drugs, that means non-FDA approval, that they have many uses in cancer. The reason why they looked at trying to explore these repurposing and repositioning is, one, because they were observing the benefit in patients with cancer, but it was because there was some need. There were productivity issues in the current drug development. It was taking too long, too expensive, and people were suffering. There was a need to address existing unmet patient needs. Help people, help patients. That's what this is about. And there was the economic impact of existing and projected cancer incidence on the health system in both advancing and developing countries, meaning things were out of control. And yet these companies were being forced to pay billions of dollars and take decades to produce products, to produce therapies that provide minimal to small benefit. So in an effort to help patients now, repurposed drugs started to pop up. And interesting, you might look at the first repurposed drug as biological warfare. See, the first chemotherapy drugs were actually born out of war. I've talked about that. Check out the Unholy Trinity earlier in the podcast in 2023. They repurposed mustard gas and other chemical weapons as biological weapons, that is, in the treatment of cancer. So then the question comes about, well, how long, Dr. Goodyear, have you used ivermectin in patients with cancer? I've been using ivermectin since 2018. So last night we were recording a webinar on hyperthermia, but a question came across, and I'll just go ahead and reread that question. What are your thoughts about the correlation between parasites and cancer? And I think that is, a good question to bring in here, because when you look at parasites, and honestly, when you look at viruses and bacteria, they have similar qualities. They grow, they replicate, they evade the immune system, they spread. So take out the word bacteria, take out the word virus, take out the word parasite, and those characteristics, those principles are the same thing that cancer does. So cancer is not a parasite, though parasites can cause cancer. That's the World Health Organization that said that 15 to 20%, and I would say more, of cancers are caused by infectious disease. So cancer is not a virus, though viruses cause cancer. Hepatitis C virus, Epstein-Barr virus, human papillomavirus, HIV, and add to that mix SARS-CoV-2. So it's those principles, it's those pathways, it's that signaling, it's those characteristics that cancer takes advantage of. So what about the anti-cancer benefits of ivermectin? Well, again, it was registered for use as an antiparasitic in 1987 by the FDA. The study types that are available on ivermectin and cancer right now are almost all preclinical. So when people question, well, where's the human studies, that is a fair and valid question. But this observational multi-center study that we are developing, it is going to help to answer the question. So we cannot be censored because we simply want to ask a question. We will not remain mindless, but we will have a curiosity in mind. So the study types that exist are in vitro, in vivo, retrospective, and preclinical. The cancer types that have been shown to be impacted by ivermectin: colon, breast, ovarian, prostate, melanoma, leukemia, lymphomas. So what are the anti-cancer mechanisms of ivermectin? What's the what of it? Well, ivermectin has been shown in these preclinical studies to inhibit growth. The more scientific term there is proliferation. Spit that out. That's exactly what parasites do, right? They grow. They proliferate. One parasite produces progeny. And in the discussion of the science of cancer, they talk about the mother cell producing daughter cells, progeny, growth, proliferation. Ivermectin inhibits cancer recruitment of new blood vessels. When cancer is growing rapidly, it needs this vascular supply to support its growth and to remove waste. It's been shown to inhibit the cancer spread, what's called metastasis. This is important because 90% of cancer morbidity and mortality is associated with cancer spread. Ivermectin has been shown to promote many types of programmed cell death: apoptosis, mitophagy, pharoptosis, cryoptosis. These are different ways in which you can initiate a cell to die, and in cancer, that's an advantage to take on. It inhibits angiogenesis, so not just neoangiogenesis, but also angiogenesis. It modifies the immune system. I referenced that article earlier where it talked about the influx of T effector cells into the tumor microenvironment, shifting the balance of the T regulator cells to T effectors, decreasing that ratio. T regulator cells are immune cells that will suppress the immune system. Yeah, I know that's crazy, but that'll happen in cancer. Cancer will recruit the immune system to its environment and then turn the immune system on the immune system. T regulators are intimately involved in that process. But here, ivermectin is being shown to actually increase T effector cells. There was another article that talked about how ivermectin turns cold tumors hot. That's a different way of saying those T effector cells. You're increasing the immune activity in the hot tumors and not the cold. The cold tumors are those that don't have immune activity. The hot are, and study has shown ivermectin induces cold tumors to become hot. Immunomodulation. Stimulates autophagy, another form of programmed cell death. Pyroptosis, I mentioned, another form of programmed death. We've already talked about how it reverses multi-drug resistance by inhibiting the P glycoprotein and multi-drug resistant associated proteins, and there's many others. We've shown that it augments other therapies, okay? Not just saying that this must replace all therapies, but that it can be used in conjunction with to improve outcome, which should be what we want. Augment immune checkpoint inhibitors, augment chemotherapy, in particular, the chemotherapies, Gemzar, cisplatin, doxorubicin. So don't we want to improve effectiveness? And with that, maybe we could actually reduce the dose, which would in turn reduce the side effects. So ladies, what if you were diagnosed with ovarian cancer, breast cancer, and you had the ability to take low-dose chemo, add ivermectin to it, and save your hair? Not get peripheral neuropathy, and then obtain remission that lasted for decades. I think that would be a good thing. It induces oxidative stress. It promotes an energy crisis in the cancer cell that induces its cell death. It inhibits mitochondrial biogenesis. Mitochondria are the powerhouses of the cell that allow the cell to replicate and grow. It's actually a regulator of epigenetics. That is the term that means above genetics. It's the expression of genetics. And it targets and inhibits cancer stem cells. That's a 2018 article And now they were looking, again, preclinical breast cancer cell lines. They showed that ivermectin would preferentially target and inhibit cancer stem cells. Interesting article, Ivermectin as an inhibitor of cancer stem-like cells. That was the title of the article in 2018. So that's the broad, the what of ivermectin in cancer. What about the how? Some of the very specific mechanism of action per published studies. It inhibits AKT-mTOR signaling pathways. So these are going to be the deep dives. It's been shown to increase what's called BAX and decrease BCL2. These are mechanisms that will promote apoptosis. It decreases vascular endothelial growth factor. This is how angiogenesis process develops. It induces immunogenic cell death. That's taking cold tumors to hot tumors. Think immune cell activity. It induces tumor infiltration of T cells, thinking immune activity. It enhances the T effector numbers compared to the T regulator cells in the tumor and tumor microenvironment. It's a potent P glycoprotein inhibitor, which is key in the multi-drug resistance. It inhibits what's called mitogen activated protein kinase, which is a very significant signaling pathway for growth that cancer will use. It blocks the WNT pathway, which is pro-growth. It inhibits heat shock protein 27. There's many, it's an RNA helicase inhibitor. This is one of the mechanisms of how it's going to inhibit viral replication. It activates chloride channels and it induces the growth 1 to synthesis phase it induces arrest in the growth 1 to S phase synthesis and mitosis. So this is how, when a cell is going through the process of replicating, it divides the genome and it stops that process. It promotes decline in mitochondrial membrane potential, which triggers apoptosis, programmed cell death. As I mentioned, it stimulates many types of programmed cell death, apoptosis, autophagy, pyroptosis. It reduces matrix metalloproteinase 9, which is very important in invasion and spread. And again, understand that the specific details are known, not just that broad how, but the mechanism. It inhibits electron transport chain at complex 1. It inhibits neutrophil extracellular traps, very intimate in how cancer will use the immune system to spread. And get this, it reshapes the tumor immune environment. It induces and increases cytotoxic CD8 T cells. As I mentioned, it increases the T effector cells in comparison to the T regulator cells. It decreases those neutrophil extracellular traps. It decreases recruitment of what are called myeloid-derived suppressor cells that come in and release that that increase that immune suppression in the tumor microenvironment. It decreases interleukin 1, interleukin 6, and tumor necrosis factor alpha. It reduces TGF-beta, which is an immunosuppressive signal that myeloid-derived suppressor cells once recruited to that environment that will use to suppress the immune system. It also inhibits the lipopolysaccharide-induced production of inflammatory cytokines, which cancer will use to spread. And it also inhibits nuclear factor kappa B, key genetic transcription factor for inflammation. So that's the what and the how. Deep dives. That's all preclinical, yes. But how does that translate to actual treatment of people with cancer? We're going to find out. We're going to find out. So we're going to ask that question. Now, as was said earlier, Mayo said, it can cause lots of side effects. Anything can cause side effects. Drinking too much water can cause side effects, can kill you. But there are some side effects that let's talk about that are real and need to be made aware of. Angioedema, swelling, Stevens-Johnson syndrome, seizures, visual impairment. I mean, there's some real side effects associated with ivermectin, but they're rare, very rare. And we're talking about dosages above 2 milligrams per kilogram, which is massive, massive. There's actually research that suggests the dosing should be somewhere therapeutically around 0.2 to 0.5 milligrams per kilogram. But again, we need more studies, and we're going to answer those questions to find those answers in studies. Then we will put them out into the public to have debate and discourse. We will follow the scientific method as created by Sir Francis Bacon. See, interesting, when you look at it, what we're following is a process of understanding pharmacokinetics. This is a key pharmacology principle. It's the course of drug distribution, absorption, metabolism, and excretion. And Linus Pauling had a famous quote regarding this, talking about vitamin C. He said, although physicians as a part of their training are taught that the dosage of a drug that is prescribed for the patient must be very carefully determined and controlled, they seem to have difficulty in remembering that the same principle applies to vitamins. Now, he's not talking about ivermectin, but I would take that and say the same about ivermectin. Pharmacokinetics don't just apply to ivermectin as it relates to antiparasitic. It applies to the principles of ivermectin as a potential antibacterial, antiviral, and anti-cancer. See, ivermectin is very fat-loving. It's called lipophilic. So you have greater distribution in women over men because of a higher fat content. It's heavily protein bound, over 90% is, and it's almost exclusively metabolized by the liver. We know how. Cytochrome P450, 3A4, and 3A5. There's about 9 to 10 metabolites that have been identified, and most of them are via metabolization of ivermectin down that CYP3A4. See, there's a lot that we know. And again, talking about toxicokinetics, the study of the toxicity associated with treatment. Most of that's going to be at really, really high doses. What we want is therapeutic. So as I mentioned, a article from 2023 and 2020 highlighted that the therapeutic dosage is probably somewhere between 0.2 milligrams per kilogram per day and 0.5. Because when you go on those much higher dosages with ivermectin, what you'll get basically complete overwhelming of those multi-drug resistant transporters, and you can start to get a lot of CNS effects. Have I seen that? One time. A person had some visual disturbances. We stopped the ivermectin, and the problem went away. And so looking at 2003 and 2021 article, and this will be in the show notes, quote, neurological adverse events have been reported in those treated for parasitic diseases in doses above 2 milligrams per kilogram per day. So we have to follow the evidence, and the evidence is telling us and guiding us how to dose. But we're going to evaluate what that dose looks like in humans. First, we start with, is there an impact of ivermectin above the standard of care in those using standard of care and prolonging life? Other side effects that aren't necessarily neurotoxic would include itching, muscle aches, cough, difficulty breathing, nausea, vomiting, diarrhea. I've seen diarrhea probably more than anything, serious skin reactions, and some swelling. Okay, so that falls in with the angioedema. Now, when you look at animal studies, interestingly enough, the median lethal dose, means the average lethal dose of ivermectin, was 10 to 50 milligrams per kilogram. So even though there's side effects associated with above 2 milligrams per kilogram, in animal studies, it's saying you can go massively higher before you actually start to threaten the life of at least an animal there. So where's the future going? Well, there have been really no reports of clinical trials on ivermectin in people with cancer. Nothing wrong in saying that. It's true. But there's nothing wrong with saying we want to ask questions and find answers to see if there is a benefit. You know, the way medicine approaches treatment of cancer today is the failed paradigm of the magic bullet proposed initially by the immunobiologist Paul Ehrlich. Now, this was then propagated by Fritz Haber into the chemist war that became World War I. So here are the proposed problems with ivermectin. First of all, quote, the specific mechanisms of ivermectin-mediated cytotoxicity in tumor cells is unclear. It may be related to the effect of ivermectin on various signaling pathways, but it is not very clear overall. Second, Ivermectin seems to induce mixed cell death in tumor cells, which is also a controversial issue. No, it's not. I just talked to you how it induces multiple types of programmed cell death. Autophagy, pyroptosis, apoptosis. See, ivermectin's effect and impact is outside the dominant groupthink processing of the time. The prevailing groupthink of science and medicine can't put its head around the mechanisms of action of what ivermectin does. So then one questions if that questioning is not allowed just simply because the groupthink, the theology, the orthodoxy, the standard of care, the protocol of the time doesn't allow ivermectin to be used simply because it doesn't fit within their thinking process. Is that science or is it not? Well, here's what I'll say. We're going to let the process of the scientific methodology show us. We're asking those questions. We're constructing the observational study on multi-center. We will soundly build out that data. That data will be publicly available when it's published, and then we can have that discussion and debate and discourse. And there may be agreements and there may be disagreements, but we will follow sound scientific principle in asking the question from ivermectin as a wonder drug to the wonder dog to the wonder dud. Is it the next anti-cancer wonder drug? Let's see what the science shows. So thank you for joining the Practicing with Dr. Nathan Goodyear podcast. I encourage you to check out other podcasts. I reference many others, the Unholy Trinity as it relates to surgery, chemo, and radiation. And then my interview with Dr. Kathleen Ruddy, a premier oncologist, surgical oncologist. And she's one of the lead and principal investigators of this ivermectin study in cancer. In this podcast, we embrace the curiosity of the mind. We won't be mindless. We want to be mindful in our questions, to seek truth in the answers. We don't create the questions to match preconceived answers. We ask the questions and we see where the answers take us. I encourage you to subscribe to this podcast, download this podcast, share this with those of your friends, family, and loved ones that would benefit from this. That could be those with viruses, bacteria, or cancer, even prevention. I also would appreciate if you dropped a 5-star review on the podcast. You can find me over at my personal brand website, drgoodyear.com, as well as Brio-Medical.com, where I'm medical director, where we implement natural, holistic, and integrative treatment strategies, and where we conduct these scientific questioning clinical studies, where we implement the idea of scientific method. You can also find us on every social media you want to, which includes Dr.Goodyear at Instagram. Remember, hope means a confidence in a future, confidence in a tomorrow. See, tomorrow exists. The confidence is that we'll be there, but it will exist. So thank you for joining us on this Practicing with Dr. Nathan Goodyear podcast, where hope is present. Hope is always there because tomorrow is there. So remember, for those of you with cancer, those of you with loved ones with cancer, hope